Welcome and congratulations on starting your Invisalign journey. If you've just had your aligners fitted today, this video will guide you through what to expect over the next few days, how to care for your aligners and how to get the best possible results for your treatments. Please take a moment to relax. Everything you're feeling right now is completely normal. It is normal to experience the following: a tightness or pressure, a mild tenderness when biting, and a slight change in your speech. These sensations are expected and they usually settle within a few days. They're a sign that your aligners are working exactly as planned. For your treatment to stay on track, your aligners must be worn for 22 hours a day. You should only remove them for eating and drinking anything other than water, brushing, and flossing. Consistency is one of the most important factors in achieving your final result. When removing your aligners, start from the back teeth and gently lift down on one side. Slowly ease them off towards the front. When reinserting, place the aligners over your front teeth first. Press down evenly along both sides, but never bite them into place. If removal feels tricky at first, don't worry. It becomes easier within a few days. You may have been given chewies today. These help your aligners sit fully against your teeth. We recommend using them for a few minutes after reinserting your aligners, focusing on any areas that feel tight. This ensures your aligners are working perfectly as planned. Those small tooth colored attachments on your teeth are completely normal. They help guide your tooth movement and improve accuracy. They may feel slightly raised at first, but will quickly feel natural. If an attachment does come off, please do not panic and let us know at the next review appointment. Always remove your aligners before eating or drinking hot or colored drinks such as tea, coffee, red wine, or fizzy drinks. Water is absolutely fine while wearing your aligners. Before reinserting them, brush if possible and rinse out your mouth with water, especially after the acidic foods and drinks. To keep your aligners clear and fresh, rinse them with lukewarm water, gently clean them with a soft toothbrush, and avoid hot water and harsh cleansers. When not in your mouth, always store them in their case and never wrap them in a tissue. You'll be advised when to change onto your next aligner, and it's usually 1 to 2 weeks. When changing your aligner, expect some mild tightness for the first day. Change them at night if recommended to allow the initial movement to happen when you sleep. It is normal for your aligners to feel loose at the back for the first few days, but then that should tighten up. If an aligner feels painful or doesn't fit properly, please let us know. Please contact us if an aligner is lost or damaged, if you're unable to wear your aligners comfortably, or if something doesn't feel quite right. Your Invisalign journey is carefully planned and supported by our clinical team. By wearing your aligners consistently and following these simple steps, you're giving yourself the best possible outcomes. Thank you for trusting us with your smile, and we look forward to seeing your progress.